And hello, it's Friday, and that means it is time for our Friday Lunch and Learn. Now, I'm looking at the camera, and I see that I have like light beams coming from the ceiling. I've never seen that before, and I don't know what all of that is about. Maybe I have a special anointing today for this little conversation. I'm hoping I can get through it without laughing. Now, what I'm going to tell you about in the beginning is very serious, but what I'm going to tell you about at the end is just a little bit funny. So if you're kind of squeamish, then you probably don't want to watch and that kind of thing. But it's all good. We're going to talk about vaginal health today. I am Dr. Polly Heil-Mealey with Abundant Health and Wellness, and we are located in downtown Humble, which is at the corner of Main Street and Avenue C. Now, I read this. Hello, Julia. Happy Friday. I know people are kind of catching up with me. I see people popping in. I don't see all the names, but hopefully we'll see them as they come in. So I see Kim. Hi, Kim. Glad to see you here. So we're going to be talking about vaginal issues, and toilet paper does matter. Now, this is what we use here in the clinic. It's Palms. It's not my favorite, but it is at least not waxed paper. You know how you go into different airports and different things, and they've got this toilet paper that is just so harsh. It's not soft, it's not pliable, and you can actually cut yourself. So guys, I know kind of you don't know all about this, but toilet paper really matters. And so I'm really particular when we go to the grocery store. I only buy one brand, and Steve will come home with a different brand, and he'll say, I know why you only get the brand you get, because it does make a difference. Now, Hillary asked me when I did the sneak peek, she said, does that mean we don't use toilet paper? No, we still going to use the toilet paper. But I'm just going to give you some case studies here on how toilet paper can be bothering you. And so normally, we think about if the toilet paper is soft or if it's pliable or whatever. But I'm going to read you this case study, and I'm going to tell you about some other things as well. And so hopefully we'll be smarter and we'll be able to make smarter choices. Now, like I said, I'm really all about comfort. And so we're real particular about the brand that we use. There are the extra soft brands, which some people don't like because it doesn't hold together. Then there are the extra strong brands that they do hold together. That might not be, while you might want that for certain reasons, they've got chemicals in there that could be causing this kind of discomfort. So I'm going to just read this to you, and we're going to talk about this, and you can tell me what you think. So it is estimated that half of all women 24 years of age and older will experience at least one episode of vulvovaginitis. Okay, that just means that your lady bits are irritated. Doesn't mean that there's a sickness and disease. It just means that you're irritated. Okay, most people say that this number is an underestimate. So this can happen because of bacterial issues, viral issues, or yeast infections. Most people think it's a yeast infection. So if you get kind of itchy down there, if you don't feel good, if you've got some kind of a discharge, most of us will go to the drugstore and we will get a product called Monostat. Used to be that was only available by prescription, but now it's available over the counter. They've got creams and they've got inserts and that kind of thing. And so naturally now they're not by prescription, and you can go and you can get that. Most women think that when they have problems that they've got a vaginal infection. However, this is not always the case. So douches, feminine hygiene sprays, cleansers, and medications that are used on the vulva and in the vagina can cause vulvitis. Now, anything with itis on it means that it is inflamed. And so we don't want our lady bits inflamed. And so when there's a problem, then we're going to want to go and find out what the problem is. So symptoms of vulvovaginitis are itching, burning, and stinging. So this sounds like a yeast infection, doesn't it? So almost half of the vulvar problems with these symptoms have no cause. There's no viral infection, there's no bacterial infection, there is no fragrance in that. And so, in half of these cases, there is no problem. So what is causing the issue? Okay. So it says when women present to their physicians, yeast vaginitis is often diagnosed solely on the basis of self-diagnosis and the patient's history, even though an accurate diagnosis requires clinical assessment, a positive fungal culture result, and a pH vaginal assessment. Now, for all those that need to know, your vagina should be very, very acidic. Now, there's a funny video clip that I found when I was researching this. I'm going to try and get it to post. It's really funny, and it's all about how if the vagina is acidic, then it's going to be healthy and it's going to be pain-free. Now, some of the fragrances and the chemicals that are involved in our personal hygiene products, tampons, pads, and toilet paper have these chemicals in there that mess up the pH of the microbiome. And so when we mess up that pH, then we've got some issues there. So if you want to know what pH is, you want to Google it, and the pH stands for parts per hydrogen, and just your basic 5th grade pH scale, okay? So 1 or 0 to 14 is your pH scale. 7 is neutral. Anything above 7 is alkaline. Everything below 7 is acidic. You want your vaginal area to be acidic. I think you want it to be a 4. I think 4 is your magic number, but I digress. Okay, someone's going to ask me, how do you check your pH? Well, you get pH paper, and you wipe the inside of the vagina with that paper, and then you watch that paper and you see what color it turns, and if it turns pink or if it turns purple, and then you'll know if you are acidic or if you are alkaline. We want the vagina to be acidic. It's probably the only thing in the body that we do want to be acidic. And my lights are dimming because I've been static too long. Okay. All right, so I'm going back to my little deal here. For many women with these symptoms, they are treating themselves with over-the-counter antifungal medications. Studies have showed that 50% of women who use over-the-counter antifungal medications do not have yeast issues. And so why are they medicating? Because they've got other issues, and that's why we're going to talk about this. In the United States, it is estimated that women spend $250 million annually on over-the-counter vaginal medications. As a result of self-diagnosis, the prevalence and incidence rates of vulvovaginitis is grossly underestimated. Okay, so this is the little case study here that we're going to talk about. So this lady, she's a 51-year-old female, and she's an office worker, and she complained of a 4-year history of vulvar rawness, itchiness, and mild swelling, okay? So she did not have any symptoms of unusual or malodorous vaginal discharge. That means she didn't have a discharge and it didn't smell, okay? She was a non-smoker with a history of hypertension, high blood pressure, and she was treated with some different blood pressure medications. She had no drug allergies, no previous history, either for atopic or contact dermatitis. So, vulvovaginal symptoms occurred every 3 to 4 months. Given any accessibility of OTC antifungal medications, she self-treated, okay? She self-treated with chlorotrimazole, which is the active ingredient in Monostat, I think. She experienced relief with her symptoms for a few months, and then her symptoms would recur. So she went to the doctor. They gave her a prescription that is stronger than what you can get over the counter, okay? So she was going to go back to her home country. Now, she lives in Canada. She was going to go back to her home country in Europe. Okay, I don't know exactly what country that was. Before she went on the trip, she sought medical opinion in a local walk-in clinic. She was given a prescription for a oral antifungal. Okay, vaginal and cervical cultures were taken at that time, and she was negative, so she did not have a fungal issue. Anyway, 2 days after her walk-in clinic experience, she traveled to her home country in Europe, and while there, she experienced complete relief of her symptoms, which she attributed to the medication. Immediately upon her return to Canada, her symptoms recurred. After 1 week, owing to family illness, she had to go back to her home country. Again, in her home country, her symptoms absolutely disappeared. When she returned home to Canada, she experienced a resurgence in her symptoms, okay? So, a test of events led the patient to begin to search for external irritants that led to the discovery of the culprit, which was bleached toilet paper. Now, although unbleached toilet paper is commonly used in her home country, most of the toilet paper in Canada is bleached. Now, most of the toilet paper here in the United States is bleached too. So I'm just going to throw that out there. You can get organic toilet paper that is unbleached. It's a little bit grayer, and it's not very soft. I haven't really looked at it in a long time, but when I looked at it before, it's been a few years ago, it wasn't very soft at all, and so therefore it did not pass the Dr. Polly approved list. However, again, I digress. So, it says the patient now uses only cheap toilet paper that is bleached without chlorine, and she has been symptom-free. Now, subsequent allergy testings in this patient using the North American Standard Screening Series, as well as moist toilet paper and diluted chlorine bleach, revealed that the patient had mild allergies to formaldehyde, lanolin, and benzocaine, but not to chlorine. So, chlorine, the actual bleaching of the toilet paper is not the problem. Apparently, it is other chemicals that are added to the toilet paper that are the problem. Now, benzocaine is what is in Orajel. So it is a numbing medicine, so I don't know why it would be something that would cause a problem. But formaldehyde, now formaldehyde, I don't really want to just read all of this to you. Formaldehyde is used to make the toilet paper stronger. So when you buy this toilet paper that is very, very strong, you've got more formaldehyde in that. And formaldehyde is what is on the Environmental Working Group website that is a known carcinogen. And so formaldehyde really, really irritates, and that is what is in the toilet paper. So apparently, if you buy unbleached toilet paper, it doesn't have any of these other chemicals in it as well, which is going to keep your lady bits happy. So if you have, and I know people come in here all the time, and they're saying that they've got irritation, they've got stinging, they've got burning, they think they have a yeast infection, when in fact, when we do some testing, we find that that's not really what they have. It may be that you're just allergic to some of the components in toilet paper. Now, I remember being a young mom, and I was very holistic on diapers. I wanted to do cloth diapers, which I did for my children. And we tried some of the different brands of disposable diapers just for convenience. And there are chemicals in those disposable diapers that help wick away the moisture, but it can actually burn the baby's bottom. And I've seen that on more than one occasion. So we don't really, really recommend that. So this is part of what they are finding, is that bleached toilet paper, right, is the cause of this, because the vulva skin, now the vulva is the outside of the female genitalia. This is the most sensitive skin on the human body. Now, we girls always have known that, but here we have it in black and white. And it says that the toilet paper, the chemicals in the toilet paper, irritated the vulvar skin and caused the vulvitis, okay? The preservatives and fragrance and antibacterial agents are all part of the problem. So we want to use toilet paper, but we want to make sure that we are not using toilet paper that has these ingredients in it so that we don't have any kind of problem with that. I continue on. They tried to get the manufacturers of the toilet paper to release their consumer information, but they all refused to provide that information, claiming proprietary rights and trade secrets. So, you know, your lady bits are really important. And so if you're finding that you're irritated, that you've got this slight burning and all that kind of stuff, it may be that you are reacting to the toilet paper. So I would say, if you don't want to have the unbleached because it's not soft, if any of you out there use unbleached toilet paper that's really, really soft, shoot me an email with a brand name because I'm all for that. I know you can get unbleached tampons, you can get unbleached pads and that kind of thing. They are more expensive, but I know they are more available. So if anybody knows of unbleached toilet paper that is not like sandpaper, I might be interested in looking at that. So formaldehyde and its reactive derivatives are used in the paper industry to improve the wet strength and other valued characteristic of paper and paper products. For example, now this is when you go to the doctor and you're having that exam. For example, the shiny, heavy, white examining table paper is much more likely to contain formaldehyde than the thinner, less expensive, duller, and more fragile type of paper. Now, we've all gone into the doctor and we've sat on that examining table and we've had that nice, firm sheet under us. And then we've all gone and we've sat on that paper. It looks like butcher paper, and when you sit on it, it tears. Well, that's really going to be better for you because it has less formaldehyde. The Environmental Working Group, EWO.org, lists formaldehyde as causing cancer. So I'm going to go on to my next little piece here. Vulva cancer. It's not just a cyst. Now, from time to time, if you're of any certain age at all, you're going to get what I call a pimple down in your private area, okay? Everybody has it. If you have cold sore virus, you might even have a little breakout down there. It's not catastrophic. It just happens. L-lysine is an amino acid that will help with that. So if you have that, then you want to take that. So this is a case study for a lady. She was 52. And she said, I noticed that I had a small lump on my vulva, and it was quite a while before I did anything about it. To begin with, it just stayed where it was. It was a hard pea-like substance just below the surface. It didn't hurt, and I was the only one that knew it was there. She only knew it was there when she felt around for it. So I guess when she was bathing and that kind of thing, she felt it. That's how she found it. She said, I thought it was almost certainly a cyst, and I just ignored it. Over the next few months, it grew bit by bit, and finally, it was about 3 centimeters in diameter, and it became quite sore. A few days later, it burst and released some horrible red flesh-like stuff. It looked like nothing I had ever seen before. It healed up, and I thought that was the end of it, but I could still feel a small lump that was about the size of a grain of rice. So, this is important, ladies. I know we bathe, we shower. You may use a washcloth to clean your lady bits. You may use your hand. I don't know what you use. You really want to take notice of what's going on in the vulva area, because if you have lumps, if you have bumps, it could be a sign that you've got something that's not supposed to be down there, okay? So over the next few months, it got bigger again. She did a smear test at the general practitioners, and she mentioned to the nurse that she had a cyst, and the nurse's response was, yes, I can see that. Her pap smear was normal. There was nothing wrong with the pap smear. The nurse didn't seem concerned about it, so I didn't, she said I didn't think about it. Once again, it grew to the same size. It ruptured as before, and it oozed the same horrible fleshy stuff that it had the first time. I felt that it wasn't a cyst, but again, I didn't do anything about it since the GP wasn't worried. I wasn't worried. Okay. So the third time the cyst got big again, she said, I decided I needed to get rid of it, mostly because I didn't like the thought of having this nasty thing down there growing and bursting and coming back consistently. Right. So it was about 18 months. So she had waited 18 months since she first had this cyst. I didn't think that it was anything to be concerned about. I Googled and looked at images of vulval cancer, and mine wasn't like any that they showed, so I felt I was safe. I made an appointment to the GP, and she took a look at it and decided it was an infected cyst, gave me antibiotics. I was to go back in 3 weeks if it didn't clear up. Went back, it hadn't cleared up, so they sent to the gynecologist to have it removed. Okay, so when she went to the gynecologist, right, he said that it was a very rare type of cancer, and they had only been able to find 2 other cases, so there was hardly any literature on it. The pathology had taken so long because they weren't sure what they were dealing with initially, and they had to run many tests to ensure that the diagnosis was correct. They sent for a CT and an MRI. It had not spread, so that was good. Now, this kind of has me a little bit chuckled. Apart from having less vulval tissue on the right-hand side, and if you look closely, you can see a long line where the stitches were. Now, who's going to go down there and look to see where the stitches are? I mean, I'm certainly not going to do that. I'm glad it was contained. I'm glad she's fine. But the takeaway of this is if you have any kind of lump down there, we all get pimples down there. Everybody does. So it's not something every time you see something that you're going to have to worry about. But if it goes away and comes back, goes away and comes back, and it has that ugly, she said it was flesh-colored discharge. So that is a real key indicator. Most of the time, if it's just a cyst, most of the time, if it's just a pimple, if you sit in the bath, soak in an Epsom salt bath, that salt will bring it to a head. It'll rupture. You'll heal up. You can also use this is a silver cream. It is antibiotic. It is antiviral. So even if it's a herpes cold sore down there, this will take care of it as well. Very, very clean, very, very nice, and you're not going to have any problems with that. So 2 things. So if you're having recurrent small vulval cysts, if they keep coming back, if they keep rupturing in the same place, you might want to go and have that checked out because that might be this rare form of cancer. Don't kind of wig out over it. Just check yourself, make sure everything's okay, and don't trip over a little bitty thing. But if it gets big and it ruptures and you've got that discharge is the key thing. Most of the people that have come into me and talked to me about it, they don't ever have anything like that, okay? So it's not prevalent at all, but it is something that's out there. Now, I want to, if you do have burning, itchiness and that kind of thing, and your fungal test is clear, we've got a great homeopathic product here. It's called a Feminine Moisturizer Herbal Salve, and it's very good. It has, what does it have in it? It has, I'm looking for ingredients. The ingredients are on the inside. Here it is. Beeswax, calendula. Now, calendula is an antibiotic. Elderflower, olive oil, and pine extract. So it's organic and it's wild harvested and it is homeopathic. So it's really, really good. We have a lot of people that use this, and it's also very, very safe. If you have vaginal dryness because you're postmenopausal, then this is a really good progesterone cream. We have this here. If you're postmenopausal, this is estrogen cream. We have it here. It's all very, very bioidentical, non-toxic, gluten-free formula. Physician formulated. I know Dr. Hunter, she's very good. She's a naturopath, and it's very, very good. So just on a little humor side, because we've talked about some nasty things, we're going to talk about some funny things now about the vagina. So we're still on the vagina, okay? So these are the 11 most crazy things that you can do with your vagina, okay? And this happened from medieval times until now. So some of these things are still happening now, and we don't want to do this. So on the Egyptian medical, I guess it's their physician's desk reference, right? 1515 BC. 1550 BC. They suggested, I don't know if I can do this with a straight face. They suggested chasing a woman's uterus around with certain smells as a general treatment for gynecological issues. They believed that a, quote, wandering uterus was the cause of most problems. And to rectify this, they would use smelly feet near the woman's nose to encourage a uterus to move downward, or to try encouraging a high uterus downward, they would put sweet scents near the woman's vagina. Now, it says, of course, you can't actually Pac-Man your uterus and chase it around your body, but they didn't know this back then, okay? Garlic on your vagina to test fertility, okay? So Hippocrates was incorrect on his gynecological health, but this is what he said. He said that the woman's mouth led right to the vagina. Okay, we know that that's not true, but back in the 500 BCs when Hippocrates was there, that's what they thought. So to test out if a woman's baby-making parts were up to par, they would rub garlic on her vagina to see if they could smell garlic on her breath. If so, it meant that her mouth to genital highway was traffic-free and thus fertile, okay? So doctors in the Victorian era, they would administer pelvic massage to induce an orgasm, right? This was the cure for hysteria. Now, I don't know, but if I had hysteria, if I was hysterical and I went to my OBGYN and he did a pelvic massage, especially if he did it to orgasm, I'm not sure how that would relieve the hysteria, but okay. That was number 9 on the list. The cure-all in medieval time from Italy, okay, was a cure for an itching vagina, was mothballs and egg whites. So you would take mothballs and you would crush them up and you would mix them with egg white till you could form a little capsule. Then you would insert that into the vagina, okay? Basically, it was an egg white mothball tampon, right? It would treat the yeast, an STI, or anything that would cause itching. Now, we're not recommending this. We're not recommending this at all. So, bombarding your vagina is a truly heinous version of the medieval s'more. Okay, you know what s'mores are. It's a graham cracker with chocolate and a burnt marshmallow, right? Okay, so this is what they did in medieval times. I'm glad I didn't live back then because this just does not even sound good for me. They suggested fumigating the vagina with a mixture of burnt marshmallows, barley flour, and egg whites to bring on a late period. So if you were not having your cycles on a regular basis, that's what they would do. I don't know if it works, but that's what they did. Now, Catherine de Medici. Now, the de Medicis were a very, very, very rich family in Italy, and she married King Henry II of France. And this was her cure for infertility. Now, it must have worked because she had 10 children. But at the beginning of her marriage, she had some problems, and this was her remedy. Don't do it. I'm not advising this, but anyway. She was in the 1500s. She drank the urine of a mare. Now, you might think that this is like crazy, but let me just tell you, Premarin is what? It's mare urine. So we still today believe in the medicinal effectiveness of mare urine. Now, we don't drink it. We take it as a pill for postmenopausal hormone therapy. So we really don't want to do that. I'm not suggesting you do that, but she did that. She drank mare's urine, and then she soaked her vagina with a mixture of manure and ground stag antlers, okay? Now, I don't know what would possess somebody to do this, but she went on to have 10 children. Now, I will tell you that ground deer antler is a powerful, powerful testosterone aid. And we do have actual products here in the clinic that have ground deer antler. And so that is something that we still use today, but we don't mix manure with it. So we're going to just say, don't do that. They were on the right track, but they just, you know, they went a little bit too far. We've just got a few more, so just bear with me. I know we're running out of time. Back in the 1800s, when bloodletting was all the rage, it wasn't just limited to leaching your skin or your limbs. Now, I've always wondered how people could do this, the leaching. They would do it if they had, what is it called? It is when you have too much iron in your blood. Anyway, I know the word, but the word's coming to my head isn't the right one. And so I don't want to even go there. So anyway, for menstrual difficulties, right? Leeches were placed on the upper thighs, the vulva, and sometimes directly on the cervix. Now, see, I've always thought that having leeches would hurt you, but actually the leech's saliva has a special anesthetizing agent, so the patient won't feel the bite. Okay? I don't know. I just wouldn't put a leech there. Okay? So making a paste for your cervix, Hippocrates again would make a paste for the cervix that was a cure for infertility. No one is positive that this worked, but they used potassium nitrate. Now, this is what makes your fireworks go off. This is what makes gunpowder volatile. So I'm not quite sure why they used this, but this is what they used. They used soda ash, and this is what the Egyptians used to mummify people. Okay, we commonly use it in taxidermy now. Anyway, they believed that the mixture was so irritating that it would open up the cervix so that people would get pregnant. Not recommending this. Arsenic, they would use arsenic. Now we know arsenic is a heavy metal. We know arsenic is a poison, but they would use it throughout history. They would use it in medieval times they would use it as a depilatory. So they would mix arsenic with some kind of a liquid. They'd put it on their bikini line to exfoliate themselves. And of course, they died of heavy metal poisoning there. Okay, the go-to cure if a woman's period was deficient. Okay, so if you had a light period, they thought that that was a problem, was to bleed the woman from the inside of her foot. And then the final one, and this occurs even up until today, and I want you to understand that you do not need to cleanse the vagina. Your vagina is self-cleansing. It will clean itself. Okay, you do not need to perfume your vagina, all right? So back in the 1920s to the 1950s, using Lysol for douching for freshness and contraceptive purposes was very, very popular. This is a bad idea because the stuff you use to scrub your dirty toilet should not be put in your body. Of course, we know that. Okay, the women suffered burns and ulcers as a result. So we do not recommend that. We also know that as late as the 1970s, women were using Coca-Cola as a douche to prevent contraceptive. So we do know that they thought that the acid in the Coke would kill the sperm. What we know is that the force of the spew from the Coke, because you would shake it up, insert, and there you go, that the force of the eruption would actually push the sperm further into the uterus, and it was not a contraceptive at all. So, ladies, again, look at your toilet paper. Make sure it's not the extra strong kind. If you have any kind of vaginal issues, get it checked out by a professional, especially if it's something that oozes, something that looks like flesh-colored material, okay? Get a picture, get a mirror. look at yourself, examine yourself, make sure that you're all happy down there, and make sure that you don't have the itching, stinging, and burning. And so if you do, it could be the brand of toilet paper that you use. So hope you've enjoyed this Facebook Live, and I will see you next week. Have a great, great weekend. Enjoy the cool weather. Take care. Bye-bye.